Uh, Good morning. Today we are going to start our lecture series in gastroenterology. Before talking about specific conditions, I would like to start with a summary of the basics of gastroenterology. You may have already known basics of gastroenterology, but here I think it would be useful for you to remember anatomy, histology, physiology, and biochemistry, as well as pathology of the liver diseases, because before understanding the basics, it will be difficult to comprehend specific conditions. Gastrointestinal diseases are generally considered in four different parts. The first is GI tractus. GI tractus is composed of oropharynx, esophagus, stomach, small intestine, large intestine, and anorectal area. It's a very long structure, and it has many functions. So most of the digestive and absorptive processes are going on in this part of the gastrointestinal system. Furthermore, GI tractus is an opening of the body to outside world. Most of the other parts are hidden in body that they do not have direct access to external world, but GI tractus is the part that it has a direct connection to external world. And we are going to talk about the particularities of this condition in forthcoming lectures. Liver and biliary tractus is another part of gastrointestinal system that is so important that it is considered even a different discipline like hepatology. Some gastroenterologists are specialized in this area. Pancreas is the same. In some countries, there are some gastroenterologists who are specialized in pancreas as well. So these parts are in their cells, may be considered as different specialties. Pancreas is a very small organ, but it has worthwhile functions in the body that its absence is not compatible with life if the secretions of pancreas are not provided. Another subject is systemic diseases. All the systemic conditions, either malignant or non-malignant, may affect gastrointestinal system. And in some conditions, the first manifestation of this systemic malignant or non-malignant disease may be a GI symptom or sign. So in this case, clinician may be confused about this. And in any case of abnormalities in GI tract, we also consider systemic diseases. So some organs far from GI tractus, liver or pancreas, may have some disorders, and it may affect GI system. And you see that we are defining several terms here, like disease, syndrome, disorder, and condition. I would like to summarize the meanings of these terms: disease, disorder, syndrome, and condition. First, I start with syndrome. In gastroenterology, there is a syndrome which is called as irritable bowel syndrome. It's very common in the population that in gastroenterology clinics, even half of the patients are considered in these functional type of GI diseases. A syndrome is a recognizable complex of symptoms and physical findings which indicate a specific condition for which a direct cause is not necessarily understood. So it means that some causes may be defined in syndromes, but in some syndromes, there may not be a definable cause. And this is exactly true for irritable bowel syndrome. We do not know the exact etiology and pathogenetic mechanism of irritable bowel syndrome that is composing a very important part of gastrointestinal conditions. A syndrome is a collection of recognizable traits or abnormalities that tend to occur together and are associated with a specific disease. A syndrome is really a collection of traits or distinctive features that run together. So it means that in syndromes, there are some distinctive features. They are present together, but a specific etiology is not there. For example, in irritable bowel syndrome, the patients are suffering from abdominal swelling, bloating, some change in bowel functions, and they are running together, but an etiology is not there. On the other hand, a disease is a medical condition of the body which disrupts the normal functioning and physiological processes. For example, inflammatory bowel disease. The terms are looking like each other, but considerably different. In irritable bowel syndrome, which is a functional condition, there is no etiology, pathogenesis, and actually it's not a disease. No morphological abnormality, but inflammatory bowel disease, there are some morphological and pathological findings that define the disease. Each disease has its own signs and symptoms attributed to it. It is generally accepted that there are 4 kinds of diseases. These are pathogenic, which means that the cause is a microorganism. It may be hereditary, some chromosomal abnormalities or diseases due to epigenetic alterations. And most of the diseases are happening as malfunction of physiological states. And some diseases are due to the deficiency of some hormones, chemicals, or else. The basic difference between the disease and syndrome is that a disease can be defined as a health condition that has a clearly defined reason behind it. A syndrome, however, may produce a number of symptoms without an identifiable cause. So we are repeating this, the same thing. A disease is a condition that is marked by 3 basic factors: an established biological cause behind the condition, so the pathogenetic mechanism is clear, a defined group of symptoms, and consistent change in anatomy due to the condition. For example, a large part of gastrointestinal diseases are composed of some functional disturbances. There are some symptoms, and the patient is suffering, but there is no morphological abnormality. There is nothing tangible. We cannot see some abnormalities in endoscopy as well as pathology, but this is still a disturbing condition for the patient. A syndrome does not have any of these features. Even the symptoms that are present are usually not consistent. So you see that in syndrome, there are many things that are vague. So the definitions are not very well established. In order to overcome this, recently, some people are coming together, specialized in this area, and defining some symptoms and their duration, their feature. And according to this, these syndromes are diagnosed. What is a disorder? Disorder, a disruption of the disease to the normal or regular functions in the body or a part of the body. For example, a disorder resulting from cardiovascular disease is an arrhythmia or irregular heartbeat. An arrhythmia is not a disease itself. It is an abnormal heartbeat that occurs as a result of having cardiovascular disease. In gastroenterology, that may be diarrhea. Diarrhea is not a disease, not a condition, but a disorder. It may result from either an disease or syndrome. Disorders can be further classified into the following areas: mental, physical, genetic, emotional, behavioral, and structural. And finally, what is condition? Condition is an abnormal state of health that interferes with the usual activities or feeling of well-being. Sometimes a syndrome can be caused by a number of diseases, or it can be a medical condition itself. For example, chronic fatigue syndrome. You may have already heard about this. Chronic fatigue syndrome is an vague disease. It's considered as a neurological condition diagnosed from a collection of symptoms in addition to the main symptom of post-exertional malaise. So chronic fatigue syndrome is a condition, but it's not a disease. It's a syndrome. So we can call it as a condition. In general, diseases, syndrome, disorders, conditions, for all these, the etiology is either genetic alterations or epigenetic basis, microorganisms, either microbes, parasites, or viruses. The cause may be harmful chemical substances, for example, alcoholic liver diseases, or some drugs, abuse of some chemical substances, environmental and occupational factors, exposure to harmful chemicals. And another condition which is common in gastroenterology is autoimmunity. Autoimmunity means that the body immune system is reacting against its structures, its cells. It is something abnormal. So the body's immune system actually is schooled against the reaction to its own structures. It reacts against microbes, viruses, parasites, or sometimes to malignant diseases, malignant cells, but it does not, in physiological state, react against its own cells. If it reacts, it's called as autoimmunity. This is a form of stray immunity. And body is highly sophisticated protective mechanisms against this disease. And we would say that the body immune system is in a state that the body protects itself more against autoimmunity than microbes or viruses. So it means that autoimmunity may be more harmful than microbes, viruses, or parasites. Because of this, Body systems have very sophisticated protective mechanisms against the development of autoimmunity. But despite this, these diseases are happening. And if these autoimmune conditions are not diagnosed in early stages, irreversible damage in GI system may develop. As we have already told, functional disturbances is an important part of gastrointestinal diseases. And in these conditions, there are several symptoms, and the suffering of the patient is considerable, but we cannot find anything tangible. No morphological abnormality, no pathological abnormality, no abnormal radiology, but the disease is there. These are called as functional disturbances. And all these diseases may be, especially functional disturbances, may be affected by social adaptation. So emotional factors are also having a great part. And finally, aging body may be more prone to GI diseases than a young body. Here you see the basic anatomy of GI system. As we have told, it starts from oropharynx, esophagus, a very long tube, stomach, small intestine, large intestine, and anorectal area. As you see, intestine is composing a very large part of GI tractus. It is around 10 meters, and its absorptive area is very large because of the presence of microvilli. Microvilli are absorptive part of intestine, and I am going to say that if we open small intestine, and if it had been possible, the area would be equal to a tennis court. You see, in our garden, there is a tennis court. So all of us are having in our intestine a very large area of absorptive surface that is similar to a tennis court. But because of the presence of microvilli, such a large absorptive capacity is squeezed in such a small space. The particularity of large intestine is that in large intestine, there is around 3 kilogram of microbes that these microbes are consistently present in every adult. In birth, there is no microbe in large intestine, but after delivery, the microbes are thriving in large intestine. And actually, if we call this as an organ, this is the largest organ in the body. So we can say that human body is a composure of an somatic structural part, in addition to these microbes, which is called as microbiota. Intestinal microbiota nowadays is considered as an important part of gastrointestinal diseases, and their malfunction does not only having some impact in GI health, but it may have impact on cardiovascular health and even neurological health. So for an healthy human being, the composure of this intestinal microbiota, which is a resident part in colon, very important. We talked about liver. We are going to talk in detail the particularities and function of the liver. It is the one of the large or even the largest organ in the body. And in females, it is around 800 gram. In a healthy male adult, it is more than 1 kilogram, 1 kilogram, 200 gram. So there is a difference between male and females. Liver has some particularities in its blood perfusion, that it is receiving blood from two systems and draining into one system. In most or all of the organs in the body, there is a perfusion coming from one vessel system and draining into another. But the particularity of liver is that it is receiving blood from two vessels, from hepatic artery and portal vein. Portal vein is an important part of GI system because it is providing all the substances, we may call this as nutrients, to the liver, that in liver, these raw substances are converted into some very vital biochemical substances and hormones to provide the functions of other part of the body. Furthermore, we have talked about that the GI system is having a direct exposure to external world. And from this external world, some harmful chemical or microbiological agents may gain access into GI system. So if some of these are absorbed and come to liver, in liver, they will either be detoxified or inactivated in order to protect the body. So besides from producing some substances from raw materials, for example, amino acids, fatty acids, or carbohydrates coming to liver, which are converted into some worthwhile substances for body. Some toxic agents or biochemical substances are also either detoxified or inactivated in liver. So we can call the liver as an gatekeeper in controlling the access from external world into the hidden part of, or protective part of body. Because of this, if liver fails to a certain degree, it is not compatible with life. And if the condition is suitable, we consider these patients for liver transplantation. You remember, for pancreas, I have told you that if we provide its secretions, life is possible. But without liver, it is not possible. So it is such a worthwhile organ. And for example, as to lungs and kidneys, there are two. So failure of one part or surgical resection of one lung or one kidney is compatible with life. Even the other part would compensate for the other, for the surgically taken one or destructed because of the disease. So compensation may happen, but in liver, it is a unique organ that it is, we have only one liver. So if it fails, it should be replaced with an transplanted liver. Otherwise, life is not possible. Now we came to the specific parts of GI tract. Stomach is an important part of GI tract that there are so many people in the population. They are suffering from stomach conditions. Stomach is producing mostly hydrochloric acid, which is necessary for the processing of the food, for absorption from the small intestine. And in addition, this hydrochloric acid is providing a barrier for microbiological agents because in this acidic milieu, acidic content, some of the microbes cannot survive. So they cannot be harmful for the body, even if they are taken by mouth. But the surface of the stomach is also sensitive for this acid. And the stomach cells are also producing mucus. Mucus is protecting stomach against its hydrochloric acid. If this mucus barrier is altered, then the produced hydrochloric acid may damage stomach wall. For example, it happens in some drugs. For example, non-steroidal anti-inflammatory drugs, which are painkillers and extensively consumed by elderly people for arthritic conditions, may disrupt this mucus barrier. And in this case, hydrochloric acid gain access to stomach surface, and it may produce some ulcers. And the ulcers may have some complications as well. And nowadays, we are dealing with too many patients in advanced age. So our, as well as world population, is aging. We are going to find so many patients affected because of the use of this kind of drugs. This acid milieu is, I have told, processing the food for further stages of digestion and absorption. And there's a microorganism, which is called as Helicobacter pylori, which is present in up to 50% of Turkish population. In some parts of the world, it is present in up to 80% of the population, but in developed countries, its frequency is less, as low as 10%. Is also a cause of stomach diseases because it, in the first stage, increases acidity. It causes gastritis and ulcers, but in later stages, it causes atrophy of the stomach. And even in some patients, it may cause gastric carcinoma. But there are so many patients, so many people with Helicobacter pylori, but very few with stomach cancer. So here, I do not want you to understand that if Helicobacter pylori is present in somebody, this patient will develop stomach carcinoma. A very tiny minority is developing, but still it means that if it is present and producing symptoms, it may be treated. The first part of intestine, the first part of duodenum, which is also called as bulbs or bulbous, is also considered in the context of stomach diseases because presence of Helicobacter pylori and presence of an consistent acidic milieu may also cause some ulcers in bulb. Actually, in most of the time, ulcer disease is affecting this area, bulb, not stomach. In stomach, mostly ulcers are due to either drugs or the ulcers may be malignant ones. So when we find ulcers in pulp, we consider that these are benign. But if we find ulcers in stomach, then we are more suspicious about hidden malignancy. Stomach wall has a very strong muscular structure. This you see here, it is in the inner part and circular muscular layer, and in the external part a longitudinal muscle layer. Actually, you remember that in stomach, we are defining 5 parts of the wall: mucosa, submucosa, macellaris, mucosa, macellaris mucosa, submucosa, macellaris propria, and serosa. So there are 5 parts: mucosa, macellaris mucosa, the muscle part of mucosa separating mucosa from submucosa, submucosa, macellaris propria, the main muscular part, and serosa. So serosa is a part of peritoneum. As I have told you, small intestine has a unique feature that it contains this villi. This villi is increasing the absorptive surface of intestine. And in later lectures, we are going to talk about a specific disease, which is called the celiac disease. Celiac disease is characterized by the destruction of this villi because of the reaction to gluten. Gluten is present in most of the grains. And in these patients, due to unknown reasons, an allergy developed against gluten. And this allergy destructs this villi. And in this case, because absorptive capacity is decreased, the patients will develop some symptoms like bloating, diarrhea, and weight loss. Celiac disease is an interesting disease, and it has some different manifestations. And because of this, in any patient with some digestive alterations or digestive symptoms, we also consider celiac disease, even if it is not very frequent. Large intestine is a different surface that absorptive capacity of large intestine is not as much as small intestine, but some absorption is still happening in large intestine as well. We talked about the particularities of the liver already, and we have told you that hepatic artery and portal vein is providing blood, and hepatic veins are draining the liver. So this one is hepatic artery, this is portal vein, and this is hepatic vein. Hepatic vein is draining inferior vena cava, and it is draining into the right atrium. The liver is a organ which is very rich in vascular structures. And if you ask me how would you describe liver, I am going to say that it is a powerhouse, a factory in the body. So it produces most of the proteins apart from antibodies, and it also provides some lipoproteins, which are energy sources in fasting. It regulates carbohydrate metabolism, fat metabolism. So it has very important particularities. We are going to talk about it later. Pancreas is a very small organ, and we would say that its size is similar to one of our hand. Its length is 12 to 15 centimeter, width 3 to 4 centimeter, thickness is up to 2 centimeter, and weight is 80 to 90 gram. Located behind stomach, in inner part it produces insulin, and from the external part it secretes enzymes that are helpful for digesting food, and insulin regulates sugar in blood. And insulin, after produced from pancreas, is finding its way into liver by portal vein, and its main effect is happening in liver. Of course, insulin does not only affect liver for carbohydrate metabolism, but it is having some important effects on muscles as well, because muscles are an important regulators of carbohydrate metabolism. It has also a rich vascular supply, and it has two ducts. One is main pancreatic duct, and this is the minor pancreatic duct. This is called as Wirsung, and this is Santorini, and there are different openings from major papilla and minor papilla. And major papilla is also opening of the bile system into the intestine as well. So main pancreatic duct and common bile duct are coming together, and they are opening into the intestine in the second part of the duodenum. In GI system, the last but not the least, peritoneum is also an important part, an important organ. It covers intestine, stomach, colon, and most of the GI diseases are affecting peritoneum, especially in advanced malignancy. We are going to talk about peritoneum in later lectures. We have already talked about intestinal microbiota, and we told you that it's very complex, and it has some very important regulatory functions, not only for GI system, but it also regulates even neurological functions, and it has also having some impact into cardiovascular health as well. We define upper GI disorders, lower GI disorders. Upper GI disorders are involving oropharynx, esophagus, and stomach, as well as the first, second, and third part of duodenum. And after the Treitz ligament, which is between the third and fourth part of duodenum, after this Treitz ligament, the part of liver for the part of GI tract is called as lower GI tract. Functional GI diseases, inflammatory bowel diseases, pancreatic disorders, hepatobiliary disorders, and GI oncology. So these are the main parts of gastroenterology, hepatology. You would recall that I told you at least half of the GI tract diseases are functional, so there is no morphological abnormality. What is the difference between functional and organic diseases? The functional ones are relatively happening in younger age. There is female preponderance, long-standing symptoms, weight loss infrequent, and mostly psychologically unstable state is present. In organic diseases, any age, it may happen in any age, but malignancy is mostly after 60 years of age. But it does not mean that malignancy does not happen before the age of 60. However, it is relatively infrequent. Male-female ratio is similar. Short or medium range history is present, and weight loss may happen. So you will see that if weight loss is present, it is a harbinger of an important condition. So in most of the time, we ask the patient this question. And if the patient has lost 10% of his body weight in the last 6 months, it may portend a serious condition. Of course, not all the time. Liver diseases, what are the particularities of liver disease? Mostly asymptomatic, even in moderately advanced disease. So this may be asymptomatic for long years. Symptoms may be non-specific. It may happen at any age, and female-male ratio is similar. Pancreatic diseases are either hyperacute, acute pancreatitis. Acute pancreatitis cannot be a misdiagnosis because it has a very, very distinctive disease that it is happening with very severe pain. So the diagnosis cannot be missed, but can be confused. So acute pancreatitis may be confused with other conditions like acute appendicitis or perforation of GI viscus, but it is a condition that is very serious. So most of these patients are finding their way into casualty department. In the past, because the imaging systems were not as developed as today, some acute pancreatitis patients used to be surgically intervened for the assumption of acute appendicitis or perforation, but nowadays, in most of the patients who are admitted with acute abdominal pain are going into imaging modalities, and acute pancreatitis can easily be diagnosed. On the other hand, chronic pancreatitis is an insidious disease. It is characterized by chronic destruction of pancreas due to some known or unknown reasons. In some patients, it may be due to repeated attacks of biliary pancreatitis or alcohol, but in at least 50% of the patients, the etiology is not specific, and the male-female ratio is the same. Biliary diseases, it may be either intrahepatic, involving intrahepatic bile ducts, or extrahepatic bile ducts. When we talk about extrahepatic bile ducts, it is composed of left main hepatic duct, right main hepatic duct, main hepatic duct, and common bile duct, as well as cystic duct. But the intrahepatic part of biliary system is different. Intrahepatic biliary diseases are having an insidious course. Females are predominating. Extrahepatic conditions, a male-female ratio is similar. GI cancer, as I told you, mostly after the age of 60 years, male-female ratio is similar, but the patients are unfortunate that in GI cancer, the diagnosis may not be evident until the late stages of the disease, especially in pancreatic carcinoma. So it is not uncommon that we diagnose GI cancers in locally advanced or metastatic at the diagnosis that is not amenable for surgical cure. And because of this, we are trying to increase our diagnostic capability to diagnose these diseases in their early stages. And GI cancer is a major cause of cancer deaths. All types of viral and bacterial diseases, for example, pneumonia, subacute endocarditis, or even urinary bacterial diseases, may affect GI tract, and especially septicemia. In sepsis, especially liver is affected, and there are some specific findings in they present as liver disturbance. And if the patient is an elderly, the first sign of septicemia may be liver abnormalities. All types of rheumatological conditions which are characterized by inflammation, rheumatoid arthritis, systemic lupus, ankylosing spondylitis, and Behçet syndrome may also present with some GI abnormalities, as well as allergic conditions like serum sickness and hereditary angioedema. And metabolic or endocrine disturbances like diabetes mellitus, Addison's disease, and porphyria may also present with GI abnormalities. We are going to talk about cases later. So here we finish our first lecture, reminding you the generals of gastroenterology, and in the following lecture, we are going to talk about abdominal examination and dyspepsia, and then we are going to go on with the other specific conditions of GI tracts. Thank you very much.